This film has been made by Opaz Multimedia and Health Talks Ltd, commissioned by the Waltham Forest Council Public Health Team and made possible by a grant from the North East London Health and Care Partnership, with special thanks to our production team.
The Youth Health Champion Film Project, introducing a series of short films which have been created in collaboration with students and staff from schools participating in the Waltham Forest Youth Health Champion programme. The project had to be adapted many times as the COVID regulations were tightened, but the Youth Health Champion teams and their school coordinators once again came through. These films highlight the value of peer-led health education as a way of improving health and well-being for young people, and show how to get started with the Youth Health Champion programme for schools and community settings.
I think one of the biggest, if not the biggest, challenge facing young people in London is kind of the image that other people have of us. Like the stereotype and like the stigma that a group of teenagers would have would probably be more negative than positive.
There are issues in education such as talking about your feelings with other people. It can be quite hard, especially when you want to talk about exam pressure and lockdown pressure. Lastly, young people also want to know how to deal appropriately with social issues such as mental health, racism in society and social media.
One main issue I would say that young people face, especially living within the area of London, is being influenced by their surroundings, and this could potentially be really negative, and an example of this is gang violence.
So what is a Youth Health Champion? Youth Health Champions are aged between 14 and 21 and have been trained in public health skills to act as peer educators in their schools or community settings. The Youth Health Champion role comprises of 4 main elements. YHCs design and deliver health campaigns for their peers. They signpost to local youth health services. They listen to and support their peers, and they can feed back on issues to the school senior management team.
I'm Jessica and I'm a former member of the YHC. I joined the YHC programme in 2017, completing my training at the end of Year 9 and then spending the whole of Year 10 as an active YHC member in my school. It seemed like a really interesting opportunity. I was really interested in having a more active role in my school and I wanted to try something new. I also wanted to learn more about the ways health affects young people. I felt like the programme was something that would teach me a lot, whilst also giving me the opportunity to give back to my school and community.
I became a Youth Health Champion back in 2010 and undertaken 2 courses, a Level 1 and Level 2 course, to learn new skills as an individual, to become a peer educator and a peer mentor to fellow students in the school, where we run a number of campaigns. And the reason for joining it was because I wanted to become a public health professional. Where I wanted to become a public health professional, I didn't know at the time, and ultimately I've ended up here as a paramedic.
I became a Youth Health Champion in order to support my school and be able to communicate with students and be a line of help. I just think it's a really rewarding thing to do, and I think it's the best thing to give back to your community.
Students aged 14 and over can become Youth Health Champions, and schools recruit a team, usually of Year 9s, who then undertake an accredited Royal Society for Public Health Level 2 qualification, the Certificate for Young Health Champions. This qualification is nationally recognised by most health and social care employers, so is a valuable asset to students planning for a career in this field. There are a number of different training providers to choose from. Some benefits of the role for schools include an improvement in pupil voice. It can provide better links with local health improvement services and can raise awareness of the health and well-being issues affecting the school community, providing visible campaigns which highlight issues affecting young people with clear signposting to where pupils can get help.
Hi, I'm Jackie Bowers-Broadbent and I am the Executive Head Teacher at Buxton School.
So Buxton School is known for a very proactive and well-established Youth Health Champion programme. What has contributed to the success of your programme?
I think what's contributed to the success of the programme is that there has been a conversation that has started within the school. Health champions have steered that conversation, and what they have done is they've allowed it to be cool to talk about mental health and children's well-being. And so certainly I think the success of the programme has been absolutely that we've been able to embrace our youth health champions, and that we've been able to join with them, although they have steered it with a conversation around what is good mental health and what is mental health, and how are we going to work through that as a school community.
There are lots of benefits for public health as well to invest in a programme like this one. So the reach of your messaging as a public health body is increased tenfold. So one youth health champion has the potential to reach around 100 young people. So their collective reach is within the tens of thousands, which is immense. The messaging is delivered by young people for young people, so the messages have more of an impact and are more relevant to them. Therefore, young people are more receptive to those messages, and so the likelihood of behaviour change is greater.
So Jess's work with the Youth Health Champions has completely transformed her kind of choices in life. She's gone on to get a job with the local council where she's part of a team of young people that does all sorts of things. They run workshops, they do training, and they attend council meetings and scrutiny sessions. So she's part of the scrutiny committee on Stop and Search. And she's also got a job working for the London Mayor, looking at how to reduce violence. So I would say the Youth Health Champion scheme has really had a big impact on the choices she's making now.
How to get involved. Watch the other films in the series for more information on the Youth Health Champions and how to set up a program. YHC programs are commissioned by local authority public health teams or independently funded by schools and youth groups. For a list of YHC training providers, please visit the RSPH website. Your public health or schools commissioning team based in the local council can provide more information on services in your area.